Hello, all, welcome to Doc Monic. On today's session, I should be talking on antiplatelets, especially aspirin. So let's get started. Coming to its mechanism. So it is an irreversible inhibitor of COX enzyme, like COX-1. So what happens when you inhibit COX-1? Like you know that COX enzyme is responsible for prostaglandin synthesis, and one of the prostaglandin is thromboxane A2. By blocking the synthesis of thromboxane A2, you just prevent platelet aggregation and vasoconstriction, leading to decreased platelet aggregation, decreased platelet activation. And since it binds irreversibly, so the action will last for 7 to 10 days. That is for the lifespan of platelets. Coming to the pharmacological actions and clinical uses, aspirin has mainly 4 actions: antiplatelet, analgesic, antipyretic, and anti-inflammatory. Actually, it's a viva question, like dose-dependent actions of aspirin, which I'll be telling later, and how each action is being made use, that you have to know. Because of its antiplatelet actions, it's been used in the prevention treatment of MI, ischemic stroke, transient ischemic attack, acute coronary syndrome, chronic atherosclerotic disease, post PCI, stents, cabbage, coronary artery bypass graft, Apla syndrome. And due to its analgesic property, it is used for mild to moderate pain, headache, myalgia, arthralgia, musculoskeletal pain. And due to its antipyretic, it can be used in fever, even though it's not used much, that you should know. And it has anti-inflammatory action, and that was being made used as for rheumatic fever, rheumatic heart disease, and other inflammatory diseases. So all you have to know its main antiplatelet actions and analgesic. These two, it's fine even if you don't write. Like I said, aspirin has dose-dependent actions. So coming to its antiplatelet action, which is seen with the 75 to 150 mg per day, that is low dose aspirin, and with the 300 to 600 mg every 4 to 6 hours moderate dose, we can see analgesic and antipyretic action. And with the 2.4 to 4 gram per day high dose, anti-inflammatory actions is seen. And more than 4 grams, it causes toxicity like increased respiratory stimulation, hyperventilation, acid-base disturbance, and with more than 6 gram per day, there is salicylism manifested with tinnitus, deafness, vertigo, sweating, nausea, vomiting. And with severe poisoning, we have metabolic acidosis, CNS depression, coma, and respiratory failure. Coming to the pharmacokinetic properties of aspirin, I don't think it's so much of useful for exams at least. But if you want to know, you should know it's highly protein bound and it's metabolized to salicylic acid, and it's excreted by renal excretion. And since you should know about since you learned about salicylism, you should know how you treat a salicylism, that is poisoning. You'll alkalize the urine because it's a acidic drug. So it depends on the concept of ion trapping, which I shall be telling on later. And I don't think half-life is important, even though they like to ask about its half-life, because half-life is not directly proportional to duration of action here. Even though it stays for like 15 to 20 minutes, the action stays for 7 to 10 days. That's a platelet lifespan. And a brain teaser for you. Guess the syndrome, pause, and guess. And if you had got it right, congratulations. And it's a Rey syndrome. And the answer for this question: aspirins contraindicate in children and adolescents with viral fevers, except for in patients with Rey syndrome. And we have a mnemonic. Even though there is risk of developing Rey syndrome, it is used in one condition. that is Kawasaki disease. And one more thing about Kawasaki. Speaking of Kawasaki, we have a strawberry tongue and we have Scarlett Johansson for scarlet fever and Kawasaki logo. Yeah, that was just horizontal integration I wanted to do. And speaking of strawberries, I just wanted to speak about all the strawberries that comes in medicine, which is important for your need. And one more brain teaser. You can pause and answer. And coming to the adverse effects, we have a mnemonic too. You should know all NSAIDs are cause peptic ulcer or at least gastritis. That you should be knowing because prostaglandins are protective for stomach. So if you remove the prostaglandins, the protection goes and they'll have gastritis and other symptoms like peptic ulcer. And if bleeding occurs from peptic ulcer, like a patient might have a iron deficiency anemia, and since it is bleeding is a class effect, like a class adverse effect, all antiplatelets can cause the bleeding. And like Sam tested we just saw aspirin-induced asthma, we saw about Rey syndrome, and you should know about nephrotoxicity and hepatic injury. You should know about this homeopathic oil. You should know only because the 5 ml of this oil can contain roughly 7 grams of aspirin, which might be harmful for if taken by especially children. So, and those who are interested to know about scientists and history, this was the person who just showed how aspirin acts, mechanism of action, for which he got a Nobel Prize in 1982. And in aspirin in Viva, they might ask about ion trapping. So it's accumulation of weak acid or weak base on one side of biological membrane due to difference in pH, because it cannot readily cross lipid membrane. That's about ion trapping. That is why, and aspirin is the classic example, like treatment of aspirin poisoning. This principle is being used. And when we talk about mechanism, you might get also asked what are hit and run drugs. So this is a list. We have aspirin, omeprazole, that is proton pump inhibitors, and another antiplatelets like clopidogrel and prasugrel. These are irreversible, and phenoxybenzamine. It irreversibly inhibits alpha receptor, and MAO inhibitors, like selegiline.